So, if we talk about pandemic virus, it is 100% resistant to remontagin genetically, and it's sensitive to Zitemivir, but until now more than 400 cases, resistant strains were discovered. In Europe it is about 2.9% in the last epidemic season. Still a low quantity, but surely it will grow, because when the preparation, ethiotropic preparation, is widely distributed and used, it generates the resistant forms inevitably. As for Zanamivir, until now they were not found resistant forms, so it is active. And finally, what will be the next pandemic? Because finally, for example, our institute, as well as in general the surveillance of influenza, which is rather costly procedure and worldwide schedule, because many institutions are involved in these regular studies. Our purpose finally is the prediction, the possibilities to predict the next pandemic. Because you see, with the avian influenza, until now we did not resolve this problem properly. Now one of the most probable candidates for the next pandemic agent is H2N2 virus. What are the arguments in favor of it? First, it was absent for 43 years from human population, though low or very negligible population immunity. Still, it is circulating in wild and domestic birds. From time to time, it is occasionally found in birds. Phylogenetically, it is very similar to H1 and H5 subtypes. Just I will show you this, the arguments of this. And it has a low genetic diversity. Now, the people who are studying this, the genetic of viruses, influenza viruses, have done the hypothesis that if we have no large genetic diversity, this subtype is very probable to be next, because it has a very big potential to form this diversity. Here are the pictures of special presentation of phylogenetic trees, radial presentations by our colleagues of our institute, and in cooperation with other institute, Vector of Novosibirsk. Here are the trees for hemagglutinin. As we see, H5, H2, very few strange H1. So they belong to very near lineages, while the other viruses have the genetic distance, bigger genetic distance. These are even very exotic for humans. This is the picture for neuraminidase, a little bit different. But anyway, there is not the genetic diversity for H2 virus. And another way of presentation of compressed phylogenetic trees of hemagglutinin. Again, we see in one family H1, H2, and H5. Very near. And finally, yes, this is a table proposed by famous virologist Robert Webster of priority of hemagglutinin subtypes to design the reserve pandemic vaccines for occasion of next pandemic. You see, he postulates the highest priority for H2. For H1 and H3, they are components already of seasonal vaccines, but H2, his arguments widespread in humans and have a pandemic origin. Once H2 had provoked the pandemics. Of high priority, he judged H5, H6, 7, and 9. They are pathogenic for humans, but low risk of human-to-human transmission. Hopefully, until now we didn't discover the chains of regular transmission of H5 from human to human. There were several communications, for example, in Indonesia, family cases, but they are not so good argumented in favor that it was transmission from human to human. It could be transmission from poultry to human. And they have established lineage in clades in poultry, and subtypes H7 and H9 were detected in pigs, while the other had lower priority. So you see that Webster also is in favor of H2 as a possible next pandemic agent. So I have finished. Thank you for your attention. Merci de votre attention.
Des questions, remarques? Sur la résistance. Je n'ai pas bien compris finalement, au bout du compte, comment on peut définir une souche résistante, puisque vous avez montré que les tests phénotypiques pouvaient être différents du génotype, et peut-être il manque une troisième colonne qui est clinical outcome.
Oui. Puis-je répondre en anglais? D'accord.
Pas en russe.
You see, this is really the problem, because, for example, WHO now classifies the resistance only on the basis of genetics, only on the basis of special mutation. For example, if you have a mutations in M protein in position 31, I don't remember exactly which are the amino acids replacement, but it judges as this virus resistant to rimantadine. If they found this mutation at the position 275 of neuraminidase, they say that it is resistant to oseltamivir. But as far as we have the experience not only in genetics but in the other ways to determine the resistance, we often obtain different results, especially for rimantadine. We cannot, maybe we cannot clearly explain why does it occurs. But, for example, clinicians, the specialists of our children clinic and adult respiratory disease clinic still say that they treated people of pandemic flu with rimantadine and had good results. And they, maybe it is not a double-blind method as it should be, clinical trial, but as a practitioners, they say that it helped people somehow, though genetically it should be resistant to rimantadine. Well, maybe I did not respond clearly to your question, but there are really some contradictions, because maybe the situation is slightly different even in vitro and in vivo. Because, for example, in vitro we can find that the virus is resistant to this compound, but in vivo this compound can be subjected to metabolic activation or somehow some metabolic transformation and form some active form, or it can be even the the question of concentration. Because, for example, rimodagine has not effect on B virus. It was established. But if you use it in higher concentration than prescribed, it can simply block intercalate in the membrane and the cellular membrane and block the receptors for the virus in a rather unspecific manner.
And do you think that animal models may be helpful in resolving contradiction between genome and test? Because you say the tests are performed by cells. That means that doing that we do study the interaction between virus, drug, and cell. But we, for example, we ignore the immune system, and as you show, the immune system has a big part to play in the stories.
Yes, I think that all these stages are necessary and should be combined. Mapping of specific mutations, research in vitro of the susceptibility, and finally the clinical results in humans. Because just also a few words about this erbidol. From one point of view, it is an ethiotropic preparation, and the mechanism of action is known. This the inhibition of fusion of hemagglutinin with the membrane of fibrosome. But from the other point of view, the same drug is judged as immunomodulatory agent and as an antioxidant agent, which can be revealed only in the organism in vivo. And if we look at its chemical structure, it is indole derivative similar to well-known anti-inflammatory drug indomethacin.
You refer to what I will call anomalous results. In other words, you have a mutation which doesn't necessarily perform in the way that is predicted. Is this possibly explained by quasi-species within the population, so that under a certain set of conditions when the infection occurs, the quasi-species variants within that population can provide a complementation effect to obviate or to negate the effect of the drug, or the opposite if the drug isn't working, to assist it to work. In other words, not genetic recombination or the assortment. I'm simply referring to complementation between variants within a population.
Yes, surely it can occur, not the complete genetic reassortment, but for, if I understood well your question, when we begin to apply this drug, we make an artificial evolution. We select by this way the resistant variants very quickly. So the prescriptions of WHO, the last prescription, were not to give the Tamiflu or the Tamivir to the patients as a preventive agent, not to use it, for example, during the epidemic. There is the note you can use twice a week or something like this to prevent. It should not be done this way, because you produce very quickly the resistant forms, and the drug will be the volume of the drug will be very quickly go down.
I was really referring to if the drug doesn't have the normal effect that you would predict.
Yes.
It could be because within the population, the variants are providing the complementary, what's the word I want, opposite effect, so that the drug can't knock out that virus. It effectively becomes resistant without being genetically resistant. It's a complementation, as in genetic complementation.
Yes.
So a function provided by the